So, Alondra, will you do the drawing for our gift card giveaway?
All right, winner is Mr. Alberstein.
All right.
Big surprise.
Fresh Bowls is a really good, sort of like Jamba Juice. Yeah, so a lot of healthy, natural stuff there.
Where are they located?
Off of Mooney, next to Aspen Dental.
Aspen Dental.
Yeah.
Oh,
South Mooney.
Yeah.
Thank you.
You're welcome. Okay, so we're going to talk about getting better results faster. So anytime you do anything, you want to get the best results you can. I do, and I want to get them as fast as I can. So that's part of what we're going to teach you how to do here, how to protect your investment in your health. And we're going to teach you spinal hygiene. So that's a little bit like dental hygiene, except in this case, how do you brush your spine every day? How do you take care of your spine so it doesn't degenerate? And movement. So movement is both part of the solution, but it's also part of the mission. So this is not just to be a little information between you and I, it's to be information that we share, that just like if you learn how to brush your teeth, you want to share it with other people. If you went along the street and you asked somebody, so how do you keep your teeth from rotting out of your head? Brush your teeth, right? Maybe floss, maybe some other stuff. So at least you'd say brush your teeth, people would have that answer. But if you went up to people and said, how do you keep your spine from degenerating and interfering with your nervous system? They'd be like, does that happen? So yes, it happens, and I want people to know how to keep it from happening, or at least prevent it to a large degree. All right, so we're going to answer some questions. So what's the leading cause of disability globally? What do you think? In workplace? What's that?
Back issues, I would say.
Low back pain, you're right. And then it's major depressive disorder, iron deficiency, anemia, and neck pain. What's the number one reason for doctor visits?
Well, I think I know what you're going to tell me, but it would surprise me.
Yeah.
If it were back issues. But,
So not exactly, but it is chronic pain.
yeah.
Okay. So now the CDC, Centers for Disease Control, and the American College of Physicians, those are groups of doctors that get together and they think about things, look at the research, they've got a lot of experience, and they'll look at things like anemia or depression or back pain or just chronic pain, and they'll say, okay, what do we think what should we tell doctors to recommend or to do? And they call them guidelines. They're not law, but they're guidelines. And it's good for new doctors and old doctors to be in accordance with these guidelines. So what do you think the guidelines say for back pain that has not been around for more than 3 months?
Probably stretching, a little exercise.
Okay, all right.
I would not think much more than Advil
Yeah.
in terms of meds.
So chiropractic and some of those things you mentioned, movement-based therapies, we'd say. And chiropractic is included in that. And Advil's not. At least not the first thing. All right, so what if pain has been around more than 3 months? What do you think the guidelines say at that point?
Then they probably get into medications, I would think.
All right, so medications, maybe surgeries. It's the same thing. Chiropractic and other movement-based therapies, physical therapy, because it just works better. So surgery, MRI, those things are not first-line recommendations. All right, so what's the number one reason opioids are prescribed in America? Now, last I checked, it was 7 million prescriptions. That was before the pandemic, and things got a lot worse during the pandemic. So what do you think the number one reason opioids are prescribed?
I assume it's pain relief.
Yeah, it's chronic pain. So we talked about being in accordance with guidelines. It seems like there's some discordance. Things are not being recommended as they are recommended to be recommended. So prescription opioids are a factor in 32% of overdose deaths. So they're really an issue, and that's prescription ones. So if we just take chronic, now I work with a lot more than pain and back pain, but let's just assume, because that's what chiropractic is known best for. let's assume it's just back pain. It's not just a matter of comfort. This is a matter of life and death for a lot of people.
Does that 32% include death from fentanyl contamination of opioids?
Probably, yeah. So it's a factor in, which means they started on a prescription and then they may have transferred to something else. But it was kind of their gateway drug was a prescription. So they wouldn't have been on it had they not had the prescription, most likely. All right. So it's a big deal, right? So if we can prevent people, if we just work within the guidelines, then we can prevent a lot of pain, disability, surgeries, and even a lot of deaths. All right, so let's start with you. So what single daily activity that you do is more damaging to your health than smoking and heavy drinking?
Probably be sitting.
All right, sounds like a good one. I'm not going to tell you. Not yet. I'll tell you later. Okay, so we've been talking about pain, which is a perception. That happens up here in the cortex of the brain. But there's a lot more under the surface. All the nervous system and the body function. And so we don't want to address just the symptoms. We want to address the cause, and that's where the solution that will address the cause then can take care of the signals that are telling us there is a problem. So if we just, if we think of it as a car with a check engine light, we don't want to just put a piece of black tape over the check engine light. We want to find out what's going on underneath the hood. All right, so me, who am I? So family chiropractor since 1996, so almost 30 years now. And my focus is on nervous system and chronic health challenges. I've been board certified in chiropractic neurology since 2007. So what is that? So let's think about what a neurologist is. So do you know what neurology relates to?
Yeah.
So it's the nervous system. So have you ever known anybody or yourself gone to a neurologist?
My wife went to one when she came down with Alzheimer's.
Okay, for Alzheimer's. And what did the doctor use? What kind of tools or techniques did he have to help?
They gave her medication to slow the progress, which is all that they can do these days.
And actually, it doesn't slow the progress. It does help with symptoms a little bit, but it actually doesn't slow no Alzheimer's medications actually slow the progress.
Yeah.
There are things that can be done, but they're super hard work. Okay, so drugs. And maybe if they're a neurosurgeon, they could do surgery, but it's really advice and drugs, and maybe surgery. So what do I do as a neurologist? And so we both start with our foundational degree, right? So medical neurologist has the MD, I have the DC, and then we go through extra training to get our neurology diplomat and specialty. So I don't use drugs nor surgery, so I use advice, but what we do is look to how can we rehabilitate the nervous system. So whether it be Alzheimer's or ADHD, autism, dyslexia, traumatic brain injury, concussions, so all those things where there's not, many of them, there's not necessarily a disease that we could find, but there are no infection, there's no trauma that's continuing, but there is dysfunction. And so how can we help to restore brain function? All right, and I've been certified in functional medicine, so that is where we look at nutritional deficiencies, toxicities, gut health, and then again, try to help the body restore its natural function. And I'm a lecturer and member of the Interdisciplinary Association of Functional Neurology and Rehabilitation. If you can say it 3 times fast, then you get to join. So that's where a bunch of different types of physicians, we get together and say, how can we help people rehabilitate naturally? And so the reason we get such amazing results in our office is because we have a different approach, and it's characterized by this term salutogenesis. It comes from the Latin saluto, which is health, and genesis, the creation of. So if I'm gonna help somebody get healthy, I need to focus on factors that generate and create health in their body, and not those that create disease. Because no amount of focusing on disease is ever going to teach you how to get healthy. There's a place for both. It's just disease doesn't get you healthy. All right. So I'm going to teach you 3 principles to apply salutogenesis to your health. And there'll be a place on this worksheet where you can take some notes. So some of them will be fill in the blank. At the back of this one is just blank, and so you can take extra notes there.
Mm-hmm.
And so up here there's health goals, immediate, short-term, and long-term. The time frames may be different. Most people come in and they say, I want to be out of pain. That's their immediate goal. And they're like, and then I want to get back to something, and that would be the short-term goal. Maybe it's work, maybe it's play, maybe it's just normal daily activities, housework or yard work. And the long-term goal is like, oh, if I felt really good for a long time and my body started working well, I could depend on it, then maybe I'd start doing this or this. So if we have these things in mind, it gives us some motivation to do the daily grind that gets us to where we need to go.
Well, I'm pretty much in maintenance mode,
Yeah.
after all this time.
So, but you can always get better, right?
No, I'm doing what I want to do.
Good, excellent. So I continue to have goals myself. So right now I'm trying to become an intermediate surfer. So,
Yeah.
Yep. So it makes me, so I do, like this morning I did 50 pop-ups and trying to get that down, get the core all flexible and strong. So, all right. So then we have traumas. These are things that interfere with our staying healthy. And so your goal may be like, I just want to maintain. I'm getting older, but I want to keep doing what I'm doing, right? So that takes work as well. So traumas, mental, chemical, and physical. We'll talk about those a little bit. And then down below, there's macro and micro. Macro is big ones, and micro is little ones. And macros, we can't do a whole lot about that. Slips and falls and auto accidents, they matter, but you can't really change them. And then micro, that's sleep position, work stress, or postures, technology stress. So as we go through, you can think of some things like, oh, that's something I didn't think about, and I could work on that. All right. So factor number 1. So this will be some fill in the blanks on this paper here. So I have different areas we can fill in the blank. So number 1 is you are designed to be healthy. So design is our fill in the blank on that one. You have the old one, so I'm going to give you this one.
Give me the.
Okay.
I wonder, where's the blank?
That's right. All right, so you're designed to be healthy. I might borrow it from every once in a while to show the camera. Okay, so design. There's a couple things in here, and that's our healthy, right? So design, we're not a mistake. We're not, we're designed. And part of that design is to have a self-healing mechanism in our body. And what we do is look, is there something interfering with that, physical, chemical, or mental, that's keeping my body from healing the way it's supposed to? Healthy is normal, and it's not seen as normal. Most of the health education comes from pharmaceutical ads on TV. It's like, if you have a symptom, you need a drug. This is the answer. There's a new drug. This is so awesome for your symptom. Well, you're designed to be healthy. Your body's supposed to heal itself, and it's not a drug that's interfering with your natural self-healing response. That's just something that usually just helps cover up the symptoms. So, yeah. All right, so when we think about being unhealthy or healthy, we think, okay, healthy, that's well, and unhealthy is unwell. That makes sense. And if you think of unhealthy as having symptoms and healthy as having no symptoms, is that true? Or can you have symptoms and be healthy? Is there a symptom that is a healthy response to something going wrong?
Well, yeah, pain is an indication of stress, which means something's going on.
Yeah, very good. So, pain is a symptom, and we don't want it, we don't like it, but it is a good thing when there's something going wrong. If you get a sticker in your foot, you want pain, right? There are some people who are born without the ability to perceive pain, and they usually don't live past 12 years old because they just can't learn to not do things that are harmful. So is it possible to be unhealthy and have no symptoms? And we gave a hint, was be well medicated. So yeah, it is. The pandemic came through and it killed a lot of people. It didn't kill a lot of well people, but it did kill a lot of well medicated people. Okay, so really, unhealthy is not adapting to stress well, and healthy is adapting well to stress. That's a more proper definition. It's not really about symptoms or not. Is there another symptom that, let's think of another symptom that could be healthy for you.
Well, just general fatigue, and then how you respond to that.
Okay, right, so maybe you need a nap, right? If you work too hard, then you just need to take a rest. What about vomiting? Is there anything good about vomiting ever?
It can be.
Yeah, if you've got some infection in you that you ate something bad, right? You want to get rid of it. So yeah, there's times those symptoms are good. What about a fever? Is there anything good about a fever?
Well, that's another clue that something's
Yeah,
off.
it's a clue, and it also makes it more difficult for the bacteria and viruses to live. So when we suppress that fever, then it allows them to live a little longer. So fever is good. All right, so this is the illness wellness continuum. So you have a choice. Every choice you make, physical, chemical, mental, is either contributing to more wellness or lack of wellness. And so we want to keep that in mind as we make those choices. And this is how patients come into our office. So they're like the little choo-choo train, and they want to be up on top of Wellness Mountain where the sheep are happy and days are good. So, but many of them are down in the valley of sickness or disease, or they're heading that way. And this train is facing that way, but it's heading this way. And that's where a lot of patients start out. Their health is declining. And so our first job is actually to slow that process down as we start to make more positive changes in their body. And then we stop it. They're still not heading up yet. And then gradually we turn it the other direction. So it's a process of restoring your health as you make more and more choices to help your body be more healthy. All right, so you're designed to be healthy. What system is in charge of coordinating your health?
Nervous system.
The nervous system, right. That's another fill in the blank on our papers. So the nervous system is the master system. So why do we call the nervous system the master system? Think like a third grader.
Well, I can't do that, but it's connected to so many things.
So yeah, literally everything. So it controls everything. So the purpose is to adapt to stress and maintain health and function. So the nerve receptors are receiving input from the body about different physical, chemical, mental stresses, and then the nervous system takes that information and says, okay, what do I need to do to adapt to it? Whether it's balance, whether it's fever, whether it's a cough, whether it's muscle contraction, it's adapting to different stresses. So nervous system is super important. Now, because it's super important, it's protected. So what's protecting the central nervous system, which is the brain and the spinal cord?
It's this backbone.
Yeah. So we have our skull and our spine. It's bone. All right. So it's like a shell around the body. But it's more than a shell. This suit of armor that's saturated with receptors. So instead of being just an old medieval shell, it's more like Iron Man shell, right? So it's almost alive. In fact, in our case, it is alive. And it has receptors that are feeding information to the brain all the time. So what kind of receptors?
Sensory, I guess.
Yeah, sensory nerve receptors. So this information between the brain and the body. And the brain really is dependent on that information, and we'll learn more about that today. Okay, so principle number 2. This is another fill in the blank. So what causes subluxation and health problems by causing nerve interference? But before we get that, what is a subluxation? I'll tell you. So here's the brain and the spine, the spinal bone, and then the spinal cord, which is nerves going from the brain out to organs like your heart, your muscles, and then information goes back. So it's back and forth information. That's normal function. And subluxation is abnormal. So that's our fill in the blank for the subluxation. So sub means below, lux is like light. So it's a low light, and then ion is energy. So really it's a low energy output to the brain from the body. So subluxation. So then that interferes the communication between the organs and the brain, going out and going back in. The purpose of the nervous system is to adapt to stress and stay healthy. And so if you interfere with that, then it can't properly adapt to stress. So it's caused by, what causes subluxations?
Also stress.
Stress.
Some kind.
Yeah, so stress causes, which is physical, chemical, and mental. cause of subluxations. It's defined as a spinal joint problem causing nerve problem or nerve interference. And it's silent initially unless there's a major trauma.
Okay, so how does disc degeneration fit into that schematic?
Yeah. So the disc spaces are here, and the degeneration is a sign of wear and tear, joints not moving correctly, wearing out, and that makes it more likely for you to have a subluxation.
But you can have disc issues that are basically trauma-induced. People used to talk about slipping a disc.
Yeah.
But
Yeah, you don't really slip a disc, but you can injure disc. And in fact, most people over 40 years old are going to have at least one bulging disc. And you can have really good function even if you have a bulging disc. It's kind of like having, and so arthritis or disc degeneration is also like a scar on your hand or your arm. And so you can still function well with that scar, but it's not going to be quite as ideal as it was before.
I've never had a diagnosis of a bulging disc, but the MRIs and the x-rays are pretty clear that particularly down around L5S1 and slightly above there, it's more than half gone.
Yeah. And so, so the discs are, they have a lot of fluid, a lot of water in them. And the way, after puberty, those discs don't have blood vessels to them anymore. And so the blood vessels are away from the spine. And so how do those nutrients get to the spine? Because it's still a living tissue. They get there through kind of like a sponge, which you squish and water goes in and out. They're not quite that porous, but that process is how it happens, really slowly and gradually. And so you need movement. And that's why movement of the spine is so important. That process is called imbibition, but we can think of it as sponge squishing. And that's what provides the nutrients. So subluxation is often, that's a dysfunctional joint, makes you more likely to have degeneration, less likely to have a proper motion, and less proper brain information.
So there's the cyclical operation of this machine here. Does it sort of simulate?
Yeah, so the
spine?
decompression is exactly for that. As it pulls apart, the spinal decompression machine pulls the spine and allows, creates a vacuum in the disc space, allows nutrients it just creates a vacuum, allows nutrients in the disc to go back in, and then it releases. And so yes, it creates a pumping motion. And then of course your daily activities, your spinal hygiene, which we'll teach you today, all those things also support that process. All right, so now we get to play with one of our toys. So pull out your paper clip. All right, so our paper clip, the head of the paper clip, we're gonna say is the brain, and the tail over here, this is the body. So what is it that connects the information between the brain and the body?
I would think the nervous system.
Exactly, yeah, it's the nervous system. And so if you're well adjusted or it's connected, then your body works with ease, okay? And then when you're disconnected, now you have this sharp point. That is dangerous. That is not good. That is dis-ease. It's not disease yet, but it's dis-ease. It's not working the way it should, and it may lead to disease. So it's subluxated or disconnected. That's a spinal subluxation, and you'll have symptoms eventually. All right, well, that's that one. All right, our next one, we get to play with another toy. And so take your rubber band, put it around 3 fingers, twist it, put it back around. So you've got it doubled up. All right, so it's a little uncomfortable, but not too bad, right? So we've got a problem here. It's the story of treating the symptoms versus the cause, which is subluxation. So the disease-focused model versus wellness model. A subluxation develops, cutting off flow of life and energy. So this is simulating a subluxation in our spine. So the disease-focused approach is just rub it down. And rubbing actually hurts when you're injured, helps when you're injured. Like if you hit your finger or something, you're like, ow. When rubbing it, it helps because of those nerve signals to the brain and the spinal cord, and they help block some of the pain. But that only goes so far. So then you go get over-the-counter medications. You go to the store and you look, okay, where is the finger aspirin? So I see head aspirin and foot aspirin. and back aspirin. I don't see any hand aspirin. Well, maybe the foot aspirin. And really, they're labeled like that, right? Like they're anything different, but they're all the same. So you get some foot aspirin, you take it, and it helps. You're starting to feel better. Then you go to sleep, wake up the next morning, and it is swollen and red. It is kind of scary looking. So you go to the doctor, and he gives you a prescription for something a little stronger, and he gives you a diagnosis, and he says, you have fingeritis. And you're like, I knew that because I looked it up on Google earlier. Yeah. So you're pretty sure the doctor got it right. And this has come back in a couple days. So you come back, and now it's starting to turn black. Your fingernails are starting to come off. This is serious. He's like, well, this is giving an infection. We need some antibiotics, and I'm gonna give you a stronger medication. I'm gonna give you some opioids now because obviously you're not faking it. This is a big deal. Come back in a week, and we'll see how you're doing. So you come back, and now the fingers are black, and it's bad. He's like, you need to go to a surgeon right away. So you go to the surgeon, and he says, well, so the good news is we're gonna be able to save your hand. So we're gonna remove your fingers, and so you do. And your fingers are off, and the problem's solved. You're all good. But you're just missing some fingers. So there is a better way. So remove the cause and allow proper flow. So let's go ahead and do that. So we take that off, and now I'm feeling so much better. Now, so interference with nerve flow causes organ dysfunction and can cause symptoms. So we have this paper here. And so on this column over here, we have symptoms. So the nerves go out, and sometimes it's not always this direct, but these symptoms over here, everything from headaches and migraines to epilepsy to constipation to diarrhea to bedwetting, ADHD. So I've seen, I think, someone for every one of these conditions, and they've gotten better. Everybody doesn't get always better all the time, but and these are not always caused by spinal subluxations. But if your nerves aren't working right, then they're going to be much more susceptible to having these symptoms.
So give me an example of someone who's been diagnosed with ADHD that has benefited from chiropractic treatment and the underlying reasons why that has been the case.
All right. So we'll go into more of that, but I'll give you an example of ADHD. So with ADHD, we're going to address the subluxations in the spine directly with adjustments. We're going to look for any neurodevelopmental, foundational, neurological stepping stones they have not made it past. So we're going to do the exam. We're looking for coordination of the body, of the fingers, of the eyes. We're going to look for vestibular reactivity. We're going to look for motor timing, auditory processing. And then we will do specific rehabilitation to rebuild or to build those nerve processes through exercises, through adjustments. We'll also check nutrition. So all those things often need to be incorporated to restore function.
The reason I asked is my daughter was diagnosed ADD, ADHD, Asperger's.
Mm-hmm.
She did a lot of occupational therapy when she was a kid to try to improve hand-eye coordination and all of that stuff. She kind of came to resent having to do it because it made her feel different. And she eventually came to rebel against it. But anyway, so I'm just thinking about what you're saying here in connection with my experience with her.
Yeah, so that's where we approach this synergistically. And so occupational therapy, that was great, but it wasn't brain side specific. And often with ADHD, it's a right brain deficiency. So we'll do things also that activate the right side of the brain. We'll look at primitive reflexes. So a lot of things that aren't checked. It's not just about getting more coordinated, although that can be helpful. And it's also about the nutrition and the spine. So, all right. So stress causes subluxation and health problems by causing nerve interference. Life is unnaturally stressful. So here we have the 3 T's, thoughts, toxins, and traumas. Those are 3 types of stress. They can be big ones, they can be little ones. And these are bad things that are stress. They can cause spinal subluxations, poor adaptation to stress is what it creates. And if you have poor adaptation, then you're going to eventually develop symptoms because the brain can't properly control or get feedback from the body. So thoughts, toxins, and traumas, I like to think of it a little bit differently as mental, chemical, and physical, because that gives us some control, some things we can do. These are generally negative. Toxins and traumas are always bad, but chemical is not always bad, and physical is not always bad. In fact, it can often be good. So there's ways you can turn this stress, this negative stress, and make it a positive input to your body. And it's important, these feed each other either negatively or positively. So if we make a positive choice, it's going to help with our whole function. Make a negative choice, it's going to affect our whole function in a negative way. All right, so what's the solution if you have a subluxation? So you can reduce or remove the stress. So that was another one of our fill in the blanks. You can reduce or remove the stress. How do we do that? So a three-legged stool. One, getting adjustments regularly. That's how you correct the subluxation. But then we want to maintain our body and make further gains if we can. So get adjustments regularly, break bad habits, and do corrective exercises. That's our three-legged stool. So what kind of bad habits? Physical, chemical, and mental. What kind of exercises are good habits? Physical, chemical, mental. And in the middle lives results. So if you get these things working well, then you get results. And then the brain glows happy and healthy, and so does the body. All right, so what's the consequence of immobility? Because immobility, or poor mobility, or poor motion, that's another one of our fill in the blanks, causes degeneration. So we talked about this a little bit earlier with the spinal disc degeneration and the decompression. So poor motion causes degeneration. Immobility quickly leads to joint degeneration. So how quickly? Well, some doctors did some studies, and they took a joint and they casted it, and in 2 weeks they took it out in different time frames, but they found at 2 weeks they could see signs microscopically of adhesions and arthritis joint breakdown. So just 2 weeks you start to see a breakdown. So we think, okay, well, how long?
From total immobilization.
Total immobilization, yeah. So in a single joint. So how long before a joint is immobile does it start to break down? 2 weeks. So that's a guideline we use when we think about adjustments, because that's where you get a subluxation, you get a joint that's not moving correctly. Is it totally immobilized? Maybe, maybe not, but it's not moving the way it should, so there's definitely going to be consequences. And 2 weeks is a good guideline for when that threshold, we don't want to go past that threshold, ideally.
So for someone who's bedridden.
Mm-hmm. Yeah, so we'll get to that here. So Dr. Joan Vernikos, PhD, she was the former director of NASA Health Science Division. And they noticed that astronauts, when they'd come back from space, they were having degenerative diseases, osteoporosis, blood sugar problems, blood pressure problems. She's like, these are some of the healthiest people in the world. What's going on? Just being in space for a very short time. And this is not 6 months at the space station either. This is shorter trips. So she's, well, I need to research this. So she found that she could reproduce all these symptoms if she just had them lay in bed for an extended period of time.
And it was roughly equivalent to being in 0G for...
Yep, took all that. So there's some positive stress as well, right? That gravity is actually good for us. So even if you smoke like a chimney or a heavy drinker or both, it's actually the constant sitting that will do the most damage. So that was our answer from earlier. What's worse than heavy drinking or smoking? Sitting. So what do we take away from this? Go ahead and drink and smoke. No, that's not what we take away from it. So we take away from it, move, right? We need to move. We need to move often. So our body is nourished by movement. And the brain is dependent upon that nerve feedback. So poor spine alignment causes brain dysfunction. So how do we know that? Well, I'll give you an example with a patient, and then we'll talk about some research. So this is about Luke. He was 5 years old, and this is how it started with Luke. They were at the grocery store, and Mom said, hey, look at the balloon up there. And so Luke does this, and Mom looks back and she's like, "What are you doing?" He's like, "I'm looking at the balloon." She's like, "Well, why don't you use your neck?" He's like, "Well, I can't." Like, "What do you mean you can't?" Like, I just can't. So she's freaking out, right? So they take her to the doctor, the pediatrician. Pediatrician says, "Let's go to Valley Children's." Valley Children's says, "Yeah, this is serious. Let's get a neurologist." Neurologist says, "I can't see what's wrong, but there's definitely something. Let's do an EEG, see if he's having seizures. Nothing there. Let's do a CAT scan. Let's see if there's any, inflammation or tumor. Nothing. It's like, okay, this is over a period of months, right? And the next is, let's do MRI, get a more different look at it. And it's like, okay, well, you've got a 5 or 6 year old at this point. He can't sit still for 30 minutes, so we've got to knock him out. Well, that's not very good for the brain. So they're hesitant to do that. It's like, I don't know, there seems to be nothing wrong, but clearly there's something wrong. So eventually they came in to see me by the time he's 7 years old. And we did our discovery exam, and eventually we had the technology to scan his spine, which we do now. And this is what it should look like, and this is what his looked like. And then we did adjustments, regular adjustments for 3 months, spinal adjustments. And also recommended he do some lab testing, look for some functional lab testing for deficiencies, toxicities, gut health. They never got around to doing that. But he improved. Got a lot better. Body was functioning, feeling better, so he was happy. But then they didn't get treatment for 6 months. They were just kind of busy. It was the holidays. He was doing baseball and soccer. And Dad was like, I think he's only 7. I don't think he should be getting adjustments all the time. So they didn't come back until his symptoms came back. And then he started feeling those spasms in his spine again, locking up, sometimes minutes, sometimes all day long. And he's begging to come back to the chiropractor. Can I go to the chiropractor? And a couple weeks later, please, can I go to the chiropractor? So eventually they bring him back in. And so we did another scan, still really messed up. But we did adjustments, got him working well again. And actually, this is old news now. It's now been over more than 2 years that he's had none of these seizing lockups. So pretty cool. So was this
Do you still see him?
Yes. Was this a spinal problem, a brain problem, or a nervous system problem? It's a trick question, by the way.
Well, they're all interlinked.
They are all interlinked, yes. So it's all of them. I adjusted his spine. That improved his brain function, and that controlled all of his nervous system and the rest of his body. So with him, he wasn't your typical 5 and 7 year old. There was something clearly wrong. It was good to do all that imaging to find out what's going on, but there was nothing there. And so it's focusing on disease. Is there an infection, disease, or trauma that we can use drugs or surgery on? And no, they couldn't find anything. So it's like, we'll just keep looking harder. Well, eventually they're like, maybe there's nothing there. It doesn't mean there's not a problem. It just means there's no infection, disease, or trauma. That's focusing on disease, and that's never going to get you well. And so we look for things that are interfering with the body getting well, and we correct those.
So what's the root cause of this condition existing at all?
Yeah, so why does he develop subluxation so easily? We don't know for sure. So it's probably some genetic issue, maybe birth trauma, but nothing that shows up on any images. And certainly nothing that needs drugs or surgery. So this is Luke with his baseball trophy, his soccer outfit, and hanging out with me. You can see he can't wipe the smile off his face, so he's super fun. And Mom shared this video of him a little while back, and it was him playing soccer. And he was at center field, and he kicked the ball, and he made a goal from half court, right? And she was super excited, but she's like, it's not just a goal. She says, look how his body moves. And his body was moving normally. And she's like, that's not the way he moved before, right? He didn't have that flexibility and mobility. He just moves normally now. So think about what Luke's life would have been like, had he just stopped at this point here. He never came to us.
It'd be interesting to see how things develop over the next 20 years or so.
Yeah. So, might he have gone on a medication? Maybe they start and go, okay, well, this maybe will help loosen up. Let's give him a muscle relaxer. Hey, if we keep him on a muscle relaxer all the time, he's a little bit better. Well, what would that do to the rest of the body function? Don't know. So would that have done something, and if he can't function the way he's supposed to, he loves sports, obviously. If he can't play sports or can't play at a level he wants to, that's going to be depressing. What other kind of stuff is he going to get into? I don't know. Is that going to interfere with his school if he has these irritations, if he gets maybe made fun of or just can't function the way he's supposed to? It's going to interfere with school. It's going to interfere with socializing. So now we don't have to worry about that. All right, so consequences of misalignment, it interferes with brain function, causes brain dysfunction, including balance and coordination, eye movement accuracy, head movement accuracy, body coordination, and interferes with your ability to adapt to stress by using your organs. That's the purpose of the nervous system, to adapt to stress using your organs, physical, chemical, or mental stresses. So what causes this kind of dysfunction? What kind of misalignment? Lack of a neck curve and head forward posture. So that's what this research showed. More than 20 millimeters head forward posture, less than a 20-degree curve will have these consequences and more. So, and this is another bad statistic, 73% of school-age children have moderate to severe head forward posture. So this is not just when kids are sitting, on their devices, right? This is when they're standing up. Okay, take a picture from the side with good posture, 73%. Do kids have trouble with coordination, with function or health problems? Problem with their organs? Absolutely. And we'll talk about the mental things in a bit, but maybe it's related to this, at least in part. There's other causes too, for sure. But we want to address the simple causes. If we can get the nervous system working better, we get the organs working better. You can stand up if you want, move around.
No, I'm just going to do this.
All right. So here's the results, one of the results from this research. This is the balance test. They stood on a balance plate and they saw how much they wobbled around. And then they did 10 weeks of treatment and they checked them again. And this is, on average, this is their improvements people noticed. It was significant improvement in balance. And they saw improvements in every one of those other factors too, including 10% increase in speed of transmission of nerves to the brainstem. Misalignment is huge in the way it affects our brain function. All right, misalignment causes other brain dysfunction, our ability to think and remember. So one study showing a full body posture, in this case, how much this is good alignment, this is good alignment, this is forward, this is even more forward. All right, the more forward they were, the more pre-dementia they had. Pre-dementia is called mild cognitive impairment. So posture affects your brain function. And this is when they stand, stand with good posture. So this is with the posture, their normal posture. And also interferes with attention deficit and learning issues. So spine affects nerve function, affects brain function. All right, one more story, specifically applying what we just learned, the impact of misalignment and spinal hygiene on health. An 80-year-old female patient of mine, she had constant alternating diarrhea and constipation, and she couldn't do her housework and she couldn't care for her husband. These are just basic things she needs to do. So she goes to the doctor, say, hey, I need some help. He gives her a prescription, and it doesn't help. And so then he does x-rays. He's taking her seriously. No problem there. Then he does an MRI. It's like maybe there's a brain problem. Maybe there's a other problem in the neck. No problems there. So gives her Vicodin. He's like, I know you're really serious. I know this is not working for you. So he's looking for disease, right? No amount of looking for disease is going to get you healthy. So now she's feeling hopeless. We took this x-ray. This is a before x-ray. She has 46 millimeter head forward posture. And then we treated her and took another x-ray. And you can see the change in her posture. And more importantly to her bowel movements were much improved. She was able to cook and clean, and she wasn't dependent on medication anymore. She just wanted to live her life, take care of her husband, be independent. Principle number 3, you can reduce or remove the stress. So you have the power to promote health by removing or replacing causes of interference to proper nervous system function. What are those interferences? What are those stresses? Mental, chemical, and physical. They cause spinal joint subluxations, interfere with the brain, communicating to the body, and then cause symptoms. So the solution, get adjustments regularly, break bad habits, do corrective exercises, physically, chemically, mentally. All right, one more thing I want to point out for you. On the back of one of those papers, let me borrow that one again. I'll get that later. Okay, so on this paper, we have start and stop and more information. So great information. There's a section on physical, chemical, and mental. So I'm going to read through that later, see if there's some things that are that you can apply from that. And the last column, more info, we can give you more information, whether it's a handout or a video series. Just text us and we'll let you know. We'll give you that information. All right, so it's our last video. This is Mr. Badman Bob, he goes by. So Badman Bob, he's called that because he's a cowboy action shooter. So he's over 80 years old now, and there's a good chance he'll be world champion this year. He's been world champion in the past, at least for his age. And yeah, so let's hear what, this is important. So he, so I think it was 2 years ago, he did 87 tournaments. And you think how many weeks are in a year? It's like, that's a lot of, that just seems unimaginable, that many tournaments. So that's what he did. He's a go-getter.
I just love it.
Yeah, he does love it, and he's very good at it. I went and watched him, and I'd see the younger guys shooting, and they're like, well, you got to see Bob shoot. And I saw Bob shoot, and he made the rest of them look like they were standing still.
I started Spinal Hygiene approximately a month ago, and I can see vast improvement. I went through the exercises that I'm doing. I do those almost every day. And they have just helped so much, and this is within a month. I was standing there and I reached over and I touched the ground, and he goes, you can touch the ground. And I said, I'm doing better now that I'm doing this program. And I said, it's helping my balance. And he says, I've been really worried about my balance. But I said, now that I'm doing the Spinal program, and I'm doing this almost every day, I said, I feel like my balance is improving, my strength is improving, my core. I said, it's helping.
All right, never too old to learn.
Looks like he's in pretty good shape.
Yep, he does well. So you can reduce or remove the interference. This is what I want everyone in the Valley to know. These three principles. You're designed to be healthy. Stress interferes with your health by causing subluxations, physical, chemical, mental health, and then you can remove it, and we're here to help. So what stress will you reduce or remove? So we think about these, you can write these here, physical, chemical, mental, and I'm going to help you today. If something hasn't come to mind already, we're going to help you with the spinal hygiene, and that'll be something right away that you can help with. All right, so why do spinal hygiene? Because your spine is critical to the whole body function, structurally and neurologically. And alignment and motion issues are common and early. They cause pain and disability, and they interfere with brain function. And spinal hygiene can prevent, slow, or reverse them. So what do we want spinal hygiene to do? We want it to promote a range of motion, because lack of motion causes degeneration and interferes with nerve function. Spinal alignment also interferes with brain function. And then coordination and balance is really what we want to do to be able to function. So how can we get that? So let's go ahead and stand up and let's do our spinal hygiene number 1. All right, so this first one is range of motion. So we have 3 different planes, left to right, front to back, and rotation. So we can do a couple of these in combo. So we'll do the sideways one. So let's tilt your head to the side. And then you keep it tilted, and then you bend your body also. Straight to the side. Some people, what they'll do is they bend their head, and then they do this. And you can see now my head's not bent. Yeah. Okay. So then we'll go the other way. Make sure you still have that stretch in your neck the same time you're doing the stretch in your back. All right, so that's side to side range of motion for our neck and our back. Now we'll do rotation. So you can do it with your hands like this, or you can just do, get an extra shoulder stretch. So you're gonna look as far as you can, then you're gonna rotate as far as you can. And if everything's working, you'll be able to look behind you. If you have a lot of arthritis or screws in your neck, you may not be able to. All right, and then go the other way, look, and rotate your back. All right, very good. Now, so that was rotation, lateral flexion, now forward. So we'll split the neck and the back into two parts for this. So you look down all the way. And these will hold for 10 seconds, but not right now. And then you go down, bend forward. So in this case, you're going to go ahead and bend your knees. So your knees can be bent so that you can get all the way down there. Because it's not about a hamstring stretch here, it's about a spinal stretch. Come back up. All right. And then we're going to look up. And for some people that hurts, and so if it's uncomfortable, you can put your hands behind your neck, push against your hands a little bit.
It's fine.
All right. And then you're going to lean backwards. So you're going to bend this part of your spine here. So it's not a look up, it's not a bend your knees, it's a bend your back. Okay. All right, so we have all three planes in there. So the next one is spinal molding. Do you have this?
Yeah.
Okay. So they're pretty firm. So if we squish them, they don't squish much.
Yeah.
And so they're helpful that way because they push that curve in. And so on the back of these, there's these. You want to put one under your lower back, one under your neck, and you do this. So on your neck, on your back, relax in position 5 to 20 minutes on the bed. So why on the bed? Well, because if you do these on the floor, they push up too much stress. Now, if it doesn't hurt, it's fine to do it on the floor, but most people are going to need to do it on their bed. There's a second reason to do it on your bed, because you want to do it every day if you can, and most people don't want to take an extra 20 minutes just to lay there. Some people do, but for those who don't, you can lay these on your bed, and you can just fall asleep, and then after a while, you just roll off of them. Okay? So start with a shorter amount of time, and then build up, because it does create a lot of stretch in your neck and your back. And then some people this may be too much to start with for some people. And so maybe they'll take, like this is pool noodles. That can be a graduating step. Or maybe somebody's very small and you take a couple, or just has a lot of stiffness in their, you can take a towel, roll it up tight, put some rubber bands around it. And also because I want this to be a movement, I want a lot of people to know about this. And so not everybody's going to have the kit. I want people to be able to do it for free or wherever. So those different modifications can work. All right, so when alignment, range of motion, or coordination are lacking, we call that a subluxation. Limitations of spinal hygiene exercise, there are some limitations. These exercises are to help maintain and prevent the breakdown. So it's not a treatment. Subluxation complex needs to be corrected by a chiropractor. So just like you can't correct a cavity by brushing your teeth.
But I have noticed sometimes when doing this kind of stuff, something will pop anyway.
Mm-hmm. Yeah, your body's always self-correcting, and so that's great. And this does promote that self-correction. So sometimes things do get corrected. And the more healthy habits you have, the more corrections will happen. All right, so it's a lifetime thing. When do it? We'll do it forever. But a good time for the range of motion is in the morning to maintain motion of the spine, encourage nutrient flow. We talked about that flow of nutrition, the imbibition, like a sponge. This spinal hygiene is an important part of that. And improve coordination of the spine. Use it or lose it. So morning is great, but really throughout the day, anytime is great. I do this several times a day. But I make sure, at least in the morning, I do the full range. We do it as part of our staff meeting. We go through all the full ranges. And the evening spinal molding, to maintain alignment, the evening's great because you can go to sleep as you start to do it. And then regular adjustments. So what does regular mean? Well, we talked about a time frame where when a joint's not moving, it starts to break down. How long is that?
2 weeks.
2 weeks. Yep. So 2 weeks is a good guideline for recommendation. Once a month is generally it's adequate, but 2 weeks is even better. All right. So extra credit. Who likes extra credit? I do. So we're going to take this wobble disc and lower this down. Okay. So I'm going to let you sit on this. So this is the way it'll work. And I'm going to do it without that. You can do it with that. Do you? Yeah. So you can. I want you to learn how to do it without the disc. So you could, or at least you can teach it people without the disc. The disc makes it a lot easier to do, but I'm advanced, so I can do it without. Okay, so we're going to go 3 different directions, or 3 different movements here. So one is forward, and so let's go backwards first. That's slouching. Almost everybody can slouch. All right, so what you're doing is you're letting your pelvis tilt backwards. Okay, and you're stretching the spine. Is it wrong to slouch? Well, I just told you to slouch, so it shouldn't be wrong, right? It's wrong to stay there for a long time, right? So it is good to move those full ranges, okay? And then we come up, tilting the pelvis the other way.
So for me, with my lower back,
Mm-hmm.
when I bend my spine this way, it does not hurt. This hurts.
Mm-hmm.
This doesn't.
Yeah.
And so I will tend, sometimes I found out when I wake up in the morning, I'm on my stomach.
Mm-hmm.
And I think this is why. Because it's relieving the lower back.
Yeah. So sleeping on the stomach works for people.
Well,
if
for
they have
some
a
people.
if you have a big belly, then it actually helps. Then you can get away with it. But if you don't, then it makes it almost always is worse. But this range of motion is good. And then let's do the one from the side. So now we're going to tilt to the side, and we pretty much keep our head the same, but we tilt the pelvis to the side. So if you're on a disc, a wobble disc, this makes it easy.
Yeah.
Okay.
Well,
So now we're going to do the other
variation
one.
of this when you're laying on your back, you just stretch one leg and then stretch the other.
Mm-hmm. All right. So then we're going to go the hula, right? So now you go to the left, and then forward, and then to the side, and then back. And if you add all those together, then you're just going around in a circle. And then go the other way. So we have this set as 5 repetitions in each one of these. All right, there's one more extra credit. And that's the resistance band. So in your kit, this is a very long band. You can use this for shoulder press or curls or whatever, but for this one, we take it behind your head. I stretch it so I didn't stretch my ears. Just a little stretch, doesn't take a lot. And then you're going to retract your head, which means tucking your chin backwards. And you hold it for 10 seconds. Do 3 sets of that. Now, what if you don't have one of these bands? So you're driving along the road, you want to do it, well, you can do it without that.
Yeah.
Okay? You can also add a little resistance with your hands. You don't need to pull, just the weight of your arms is more than enough. And you just tuck back. If you can't really get the feel for it, then you can go the opposite way and then reverse it.
They had me doing that in physical therapy after my shoulder. So
Yeah, this is one of the most favorite physical therapy exercises. It's that head retraction combined with a couple other things. Okay, so when you do that, anytime your head's been forward for a while, especially if you've been devicing, it's a great time to do that head retraction.
Yeah.
All right, so now what I've done is I've given you a bookmark. In fact, I've given you 2 bookmarks. It's not just because I know you're an avid reader. It's because I want you to give one away. Maybe you give it away as a card, or maybe you take a picture of it and send it to somebody. So I want you to teach spinal hygiene. At least these first 2. It's like if you just learned how to brush your teeth and keep your teeth from rotting, you really want to share that. And so this is a way to keep your spine from degenerating and interfering with your nervous system. We want it to be a movement. We want everybody to know the answer. So on there it's got got the every morning range of motion, every night spinal molding, wobble and band exercise, adjustments, chiropractic adjustments every 2 to 4 weeks, and then these core exercises. We're not going to teach those today, but that's the bridge, side bridge, and cross crawl.
Yeah.
Okay, so I have a challenge for you. The challenge is to do at least 2 exercises per day for your spine. So what's good 2 to do? Well, a good 2 to start with is the range of motion to the spinal molding. And then, of course, these other ones are great to add also. What do you do after 21 days? Just keep doing them, right? Okay, and then I want you to share this message. We already talked about that. Because we want to make, my goal is half the people in Tulare County know they're designed to be healthy. There's something they can do about it, addressing physical, chemical, and mental stresses. And we're here to help. And then maybe we teach them spinal hygiene. But I want them to know those 3 things. And we have a community outreach program. I was really busy with this last week. And that's where we go to different places and teach this and other things. But spinal hygiene is one of the most popular. And so we'll go to On Location. We'll do this for free because part of my mission is to restore hope and to educate people.
Where do you typically go to do this?
So last week I went to a business in town, Elite Medical, and also went to Arts Visalia. Also have done lectures for the Tulare County Retired Employees Association, and also for Central Valley Christian junior high biology classes, about 130 kids. We talked about gut health at that point. So these are some of the topics. Like I said, spinal hygiene is one of the most popular. We also have unraveling neurodevelopmental disorders, destroying dementia, eliminating migraines, healing gut-brain connection, overcoming neuropathy, and ergonomics for the office worker workshop. And most of these we have coming up in this next 4 or 5 months. We'll be doing in the office. And when I do a workshop on location, then I will offer this if they have a charity that they support, or they happen to be a charity or nonprofit themselves. Then we'll actually do a donation. I'll tell you about that in a second. But this, usually our initial evaluations are $275 a person for the ones that aren't very neurologically complicated. But for this workshop, we do it for $145, and then we'll do it for $245 for the whole family. And in fact, we had one person ask, well, how many does that include? And I said, well, we've had up to 7. And she said, well, I have 6 kids, so that'd be 8, including me and my husband. I'm like, you'd be the new record. So it keeps us busy, which is good. And then, and so that includes exam, x-rays, report, includes also 1 treatment. So the total cost for all this, assuming we did a couple x-rays, would be close to $450, $500, and so we do it for $145. But then, if it's a charity, then we'll actually take that money and we'll donate it back. The amount that they paid, we'll donate that back to their group. So that's kind of fun. All right. So as we think about from the beginning, this is our last slide today. We think about the beginning, we had the disability from pain, the frequent opioid prescriptions, even the deaths from prescription of opioids, which are most often prescribed for pain, which is most often back pain. And we think about Luke, the 5-year-old, and his future. We think about Bad Man Bob, just loving life and enjoying more. We think about the 80-year-old woman who couldn't care for her husband, and she was getting more and more medications. So this is why we do what we do. And it's and the medical system is not designed for these things. The medical system is designed for disease, infection, and trauma. And it's really good at that. And if you have one of those, they're going to save your life, and most likely, and that's going to be awesome. But if you want to get well, you have to take a different approach. And that's where salutogenesis comes in. So think of this as a newborn baby zebra laying on the ground, just been born, and mama looks down and says, hey baby, you got to get up and you got to run. And the baby looks up and says, I've just been born though. And mama's like, I'm your mama. I know you just been born, but you got to get up and you got to run. The baby's like, oh, the grass is so green and I'm so tired. Why do I have to run, mama? She says, baby, the lions are coming. You got to run. And so lions are coming for us too, and that's these degenerative diseases of our body. And the system is not protecting us. We have to take action for ourselves.
So traditional medicine and chiropractic medicine are not actually mutually exclusive.
Absolutely not.